ADPKD stands for autosomal dominant polycystic kidney disease. It's a genetic, chronic condition that causes cysts to develop in the kidneys and other parts of the body. Over time, these cysts grow, they can cause pain, and sometimes they can stop the kidneys working properly. Being diagnosed with ADPKD can be overwhelming, so it's really important that patients and their families can get the care and support they need to cope with this lifelong condition. The ADPKD Route Map explains what patients and families can expect from their health services, and also gives some ideas of how people can keep themselves as healthy as possible. Ultimately, the aim is to give everybody the right information and support they need at the right time in their journey with ADPKD. The Route Map has been developed by PKD International and the European ADPKD Forum, that is by patients and physicians working together.
Today I want to talk to you about ADPKD and ask you to imagine it as a journey throughout the rest of your life. We've come up with this route map to help you to think about ADPKD at different stages so that you can understand the disease more and to be able to discuss with your doctor and your family and make informed decisions about your future care. So in this route map, we've tried to map out ADPKD along the course of a lifetime. We're trying to help people to understand how ADPKD is diagnosed, how it may affect kidney function, how we manage the complications, including those outside the kidney, and finally, when the kidneys fail, what are the options for dialysis or transplantation. What's great about the route map is that it's not just a book of facts, but it's fully interactive and enables you to look at different topics according to the different stages along the journey. The route map is really helpful in understanding that ADPKD is not just a kidney disease. Indeed, blood pressure is very common, and pain too in many patients. However, some patients develop more problems in other organs such as the liver and the brain, and for these they need specialist medical care. So the route map helps you to understand the different complications that can arise and where you need to seek help.
My own field is medical genetics. ADPKD is a common inherited or genetic kidney disease, so many individuals and families with this diagnosis will often have important questions about this aspect of the condition and also their care. The route map provides important information about genetic aspects of ADPKD, including how it is inherited and whether genetic testing may be appropriate within the family. Individuals often have important questions about whether screening or genetic testing is important for their own children, and a referral to clinical genetics is often the ideal opportunity to ask those particular questions. In addition, individuals may also have questions about family planning, which in the past they may not have felt able to discuss openly with their own doctors.
There's a lot of information about ADPKD, particularly on the internet. The route map provides a reliable source of information that patients and families can trust. There's also advice about coping with the effects of ADPKD and information about well-being, family life, and getting help and support with your finances. Hearing from other patients can make a real difference. So in the route map, there are messages of support and encouragement from patients all across Europe. There are also checklists to help patients get the most out of their consultations with doctors and other healthcare professionals. These checklists can also help healthcare teams to make sure that patients are kept at the centre of their care pathway. It's true what they say, knowledge is power. Learning about ADPKD can empower patients and their families to cope better with the disease and ensure they get all the care and support they need. The route map really is for everyone. It can help patient organisations, healthcare providers and policymakers ensure that the services they delivered are truly patient-centred.